Assalamu alaikum. Welcome to interesting radiology case series. Today I am going to explain to you sonographic features of endometrial polyp. Today's case is a 45 years old female who presented with pervaginal bleed and specifically mid-cycle bleed. Her history had been of only 1 week. On pelvic ultrasound, this is sagittal view. You can appreciate a normal sized uterus which is not enlarged, and there is a hyperechoic lesion, this one in the upper part of endometrial cavity. This lesion is also causing dilatation of the upper part of the endometrial cavity. And here, this you can see is the endometrial lining of the inferior segment of the uterine cavity. We can also appreciate that the fundus is distended, as you can see, and there is also thinning of the myometrial wall of the upper part of uterus. And here you can see that myometrial wall is comparatively not thinned. So this establishes the fact that this lesion lies inside the endometrial cavity. Now this is transverse view of the endometrium, and you can appreciate splitting of the endometrium here towards the inferior aspect of the lesion, which is also suggestive that this lesion, this hyperechoic lesion, lies within the endometrial cavity. On color Doppler ultrasound, you can appreciate a central artery entering into the lesion from the anterior wall of the uterus, and you can also see a hyperechoic area surrounding this central artery. This is the vascular pedicle, and once you are able to see the vascular pedicle, it is also establishes the fact that the lesion you are viewing is actually an endometrial polyp. So the sonographic features of an endometrial polyp, we can recap like there is obviously a negative pregnancy test in this patient. There is a hyperechoic homogeneous lesion lying within the endometrial cavity. There is a vascular stalk which is entering into the lesion arising from the anterior uterine wall, and these facts make it established as a diagnosis of endometrial polyp. There are two main differentials: retained products of conception, but obviously pregnancy test would be positive in that case, and the other important differential is a submucosal fibroid. And to differentiate these two lesions, submucosal fibroids are usually hypoechoic, and also the vascular pedicle is not a feature of fibroids. So I hope you found this case interesting, and you will be able to differentiate endometrial polyp confidently next time. Thank you so much.